Hello, I'm Dr. John Cruz, and today I'm going to be talking about the default mode network and depression. Now, I usually start with the takeaway message for people who don't want to sit through the whole thing. The default mode network, connectivity within the network and between the network and other networks in the brain is almost certainly intimately involved in depression, both the maintenance and origins of depression, and probably provides a more comprehensive and meaningful explanation for depression than just claiming that it's due to serotonin defects or problems. But there are lots of complications, nuances, and this is not a simplistic answer to understanding depression or revealing what all the possible ways of alleviating depression. So one of our previous talks, I talked about networks within the brain, and we talked about the default mode network, so I'll try to recap that quickly. So in some of the earliest studies looking at brain activation, they would have patients or subjects in the experiment perform a certain mental task, look at them during the functional MRI or other device for measuring brain activation. And as a control group, they would tell the patients to just let your mind wander, don't think of anything, just sit there and daydream. And somewhat naively, in the very earliest days, the assumption was that mind wandering, doing nothing state was an inactive brain state. And then when they started crunching data and looking at it, it was found that this, again, just let your mind wander, daydream state involved a coordinated action among several different parts of the brain. So these parts of the brain were active together, and that is by definition what a network in the brain is. It's when different parts of the brain are active together. And the components of the the components of the default mode. So again, it was called the default mode because it was the system that was engaged when you were not specifically working on a task, but just letting your mind wander or daydream. So the default mode network, different people have slightly different definitions of what's included in it, but certainly the medial prefrontal cortex, parts of the posterior cingulate cortex, the precuneus, the angular gyrus, and parts of the parietal cortex, including hippocampus and parahippocampus, are part of this network or system. So the most simplistic and early connections with the DMN, the default mode network, suggested that people with depression had an overly strongly connected default mode network, and that sort of fit with if part of depression. So the other, I'll jump back a little bit more explaining what. So with the default mode network, again in these experiments, it was associated with just ruminating, let your mind wander, daydream. When it's been studied more explicitly as a system itself, it seems connected or a source of our autobiographical information. So when you're reminiscing about yourself, your past, events in your past, your emotional state now, how you understand emotional states of others, and a whole host of other sort of autobiographical and socially connected systems. So it would make sense on a superficial level, anyway, that since depression itself and anxiety states, and there are strong correlations between depression and anxiety, that both of those conditions are associated with an overly ruminative, overly introspective, overly examining yourself, your role with others, how you think it's defective, deficient, lacking, substandard, failing, and that system, again, some of the early studies found that the people with depression differentiated from people who didn't have depression by stronger internal connections, what's called stronger coherence, that when parts of the default mode network were firing, you're more likely to get firing of the whole system going at a time. So the thought was these people who are mired in rumination we're more prone to developing depression, and that depression may be a product of spending too much time in this ruminative state. And what further reinforced some of this study is that treatments or approaches to life or practices that we know deactivated or disrupted the default mode network. Particularly meditation's been looked at extensively. So meditation is not just a daydreaming, letting your thoughts wander, internally focused state. Meditation usually involves some set of either trying to clear your mind of all thoughts or focusing on one specific thought, and if your mind wanders, returning to that thought. And there's a strong correlation between deactivation of the DMN, the default mode network, and meditation, and indeed meditation in a variety of different teachings and practices seems to be correlated with having some antidepressant action. There have also been studies looking at antidepressant medications, and at least in some of these studies, people treated with depression, treated with antidepressants, seem to have a normalization of their DMN so that their default mode network is less strongly internally linked within itself, that it looks closer to a normal pattern of activation. Developments or advances of it, in part because some studies didn't find overly linked or overly coherent DMNs in people with depression. So a more evolved view of what's going on with the default mode network in depression is that there's a hyper connection between negative emotion centers, or the flow of negative information, negative emotional state information into the ruminative default mode network state. And this is through activation of the anterior cingulate cortex. So, and this fits better because there's certainly people or individuals who do a lot of daydreaming who never wind up being depressed. So it's clearly not as simple as activation of default mode network or even hyperactivation of default mode network is the same as or equal to depression, because again, some subset of people are able to daydream a lot of their time or lives away without falling into depression again. So again, this flow of negative emotional state and sort of poisoning or directing to specifically negative self-autobiographical information, negative emotional states, imagining negative emotional states in others, and connections between. So some of the other treatments we have for depression, research groups have looked at whether they are having effects on the DMN. So studies looking at transcranial magnetic stimulation, TMS, have found that there are one of the findings is that the increased input to either salience mode networks or executive, so usually in a normal state, when the DMN, the default mode network, is activated, other states are deactivated. So there's an inverse relationship, a decoupling. So when you're actively engaged in a task, you're using your executive functions to work on a project, to plot a course, to learn a physical skill, to engage in the world in that mode, there's a strong anti-correlation. So when that executive function mode is on, DMN tends to be off. Also just the salience mode network, so paying attention, if you're paying attention to sensory information, if you're paying attention to social contacts or tasks, again, the DMN is usually deactivated. And at least some of the studies with transcranial magnetic stimulation found that there was stronger input from dorsolateral prefrontal cortex, or some of the executive function sites, into the DMN. So rather than sort of isolating DMN is active in this, TMS allowed sort of greater ability of other systems in the brain, other networks to shut off or turn off the dorsal medial, default mode network. Keep saying it wrong. This also fits with part of why cognitive behavioral therapies might be helpful, and particularly something like behavioral activation, where you're getting someone to be engaged, active in their world around them. If they're active in the world around them, they are deactivating their default mode network. And again, that may break up this depressive ruminative state. Other aspects or approaches of cognitive behavioral therapy get people to focus or engage in sensory input, to look around. What are they looking at? What are they seeing? What are they feeling? Again, all these approaches to pull them, as people say, out of their mind, out of their funk, out of their negative ruminations of thoughts, which are, again, characteristic of depression and seem to be a manifestation at a subjective experiential level of overactivation of these default mode network circuitry in action. And this default mode network sort of theories or approach or explanations for depression also fit, I would say, with why traditional psychoanalytic theory is not always remarkably effective for depression. I'm not saying it never is, but there is more than a grain of truth to the sort of Woody Allen neurotic stereotype of someone who goes to therapy, particularly explorative, psychoanalytic oriented, where you're mulling over childhood, you're mulling over past experiences. You may get good insights into that, and I'd certainly say there's an important value to learning more about yourself and why you have certain patterns, but it's this current theories about default mode network might suggest that while you may gain insight, while you may gain information, while that may make you a fuller, richer person, it may do not much to help you get out of depression and may actually worsen depression or strengthen depressive state, because what you're doing is spending time ruminating, you're spending time looking at autobiographical information, you're spending time thinking about your own negative feelings and thoughts, and the more you practice these certain states, the better your brain gets at doing them, the more strongly connected and mired in that circuitry you are. So again, whether I sort of highlighted or talked about some of the problems with this, with the DMN explanation for depression. One is that there are some conflicting studies or data on whether the DMN is hyperactivated, is hyperly strong connected, or is more disconnected in people with depression. So part of it is different study groups use different protocols, different study groups use different definitions of what parts of the brain are included in the DMN. We're still sort of at the rudimentary or interesting early stages of research, but there are, I'd say, positive inclination, positive formulations, and again, so another fault or problem with this that I foresee, particularly as it's popularized, as I'm maybe attempting to do right now, just as the older popularization that depression's just a shortage of serotonin, and boosting the serotonin is going to alleviate depression, we know that that just isn't true even on a surface level overall. My fear is that some of the nuance, some of the complexity of what even a brain network is, and again, I talked about this in the network discussion a few weeks back. If you're thinking that a brain network is just sort of like a cassette, you slip into the brain and it's this hardwired set of connections that are always activated and you can just pull it in or turn it off or turn it on, and that all the parts of it are always linked to each other in the same way or strength, that's clearly not the case. So it may be a little, at some levels, and at other levels this analogy falls through, that networks in the brain can be thought of like a network or a team at work. So you may work regularly with Joe and Bobby and Ann and Freddie and Sally, and when you're working on a big task, all these people are working together, so activity in one person is correlated with other. But all of these individuals, so all of the brain centers within a network, are also involved in other networks, other systems, other functions, so that other times Sally may be playing softball, or she may be working with her kids, or her activity in Sally at other times isn't correlated at all with what other parts of the team or network she is a part of in the work situation. So, I mean, each of the areas of the brain even consists of millions, billions of neurons. Each of those neurons have thousands, hundreds of thousands of connections to other neurons. The boundaries of what an area in the brain is are usually fairly indistinct and muddy. All of these areas have connections to multiple other systems, other areas of the brain outside of what network they may be primarily linked to or working within. So brain network theory is always, our approaches are always going to be messy, complicated, like real brains and real lives are. So one of my sayings is, if you're not embracing nuance, you're creating new angst. So we're going to have to get used to complicated, messy explanations rather than simplistic A does B, or this causes depression, or this will alleviate depression. So I think that's about all I'm going to say for today. Next week I'll be talking about marijuana and ADHD. It looks like a few people are listening in. I'm not seeing any questions come up right now. I'll sort of pause for another second or two before I end. Again, this will be posted both on YouTube and on Facebook, and if you have questions at a later time, you're welcome to try to type them in, and I will try to respond. Okay, stay safe, stay well, have a good, healthy, happy week. Bye for now.